One group hit very hard by the coronavirus and seemingly not getting a lot of attention are veterans. As a whole, a higher percentage of veterans infected with the virus have died from the disease when compared to the rest of the general public. To date, more than 5,500 vets in VA care have tested positive for the virus, and the death toll has climbed to 361. Holyoke Soldiers Home in Massachusetts is seeing a major outbreak. At least 50 veterans have died there after testing positive for coronavirus, with an additional 90 residents and 81 staff members infected. Joining us now to help us understand all of this, Secretary of Veterans Affairs, Robert Wilkie. Mr. Secretary, thank you for joining me. At this point, how many VA employees, thank you, how many VA employees have died and how many VA patients have died?
Well, 19 VA employees have passed away. Most of those had no contact with our patients. They come from all over the VA. And as you mentioned, we've had 361 veterans die out of the 9.5 million veterans who are in our system. I'll also talk about the employee infection rate. We have the lowest employee infection rate in the world. It is less than half of 1%. You compare that with Italy, where 25% of the cases in that country were healthcare workers. And in most places in the United States, we're seeing upwards of 3, 4, 5, up to 10% of clinical employees who are infected. And you just had a lead-in which mentioned homes in Massachusetts. Those homes are not run by the Department of Veterans Affairs. In fact, we are engaging our fourth mission, Stephanie, to go in and help the states and localities with facilities like that. We sent 50 nurses into Massachusetts to help those homes that are run by the Commonwealth. We've just taken over 2 veterans' homes in the state of New Jersey by deploying nurse teams and doctors there. And we're sending 16 teams into Florida to help with their nursing homes. That is part of an obligation that we have as part of our fourth mission to be the bridge between the federal government and the states and localities, and we take that mission very seriously.
Then I want to be sure I have that number right. It's 19 deaths for VA hospital workers, and it's 331 veterans in the VA's care who have died. That's correct?
No, it's 19 Veteran Affairs employees. Most of those are not VA clinical employees. They work in our benefits administration. They're engineers. So the majority are not in the clinical category. And it's 361 veterans who have passed away out of the 9.5 million veterans who are part of our VA healthcare system.
Then how many of your healthcare workers?
Well, I just mentioned we've about 40% of that 19. The reason I went into the law, I don't do the math very well. Of the 19 who have passed, and they are healthcare workers. Now, we don't know in most of those cases where the infection came from. My parents' hometown of New Orleans, we suffered a lot of employee infections there, but we trace most of those to Mardi Gras and the state not locking down the city early on in the epidemic.
You were saying the infection rate is much lower here than it is in other places like Italy, but we're also seeing in those countries a lot more people actually being tested. How many people working for the VA in VA hospitals have access to the test? How many have been tested?
Well, we've tested well over 60,000. In fact, I was just in the D.C. VA yesterday walking through their testing labs. They can do hundreds of tests a day, and we're making sure that everyone who comes into contact with patients, particularly in our living centers, in our spinal cord centers, we're making sure that those tests are available to them. That is an important thing to say. When we have less than half of 1% of our employees who are infected. We are making sure, and I heard your lead in, we're making sure that the people who are on the front lines, who are in the emergency rooms, who are in the COVID wards, who are in the ICU wards, they have the equipment that's needed. What's changed, Stephanie, is that this is a national emergency. That's why we're helping the states and localities. And I will be brutally honest with you. We have policies in place where people who have no contact with patients, they're not going to get 3 changes of protective gear every day. So that is one area where I will tell you truthfully, we don't have those employees who are given masks and gowns on the same rate that those who are on the front lines are given. But we are giving them to them. And I think you see by the percentage of our employees who are infected that right now we're doing a pretty good job.
Then please tell me exactly what you're giving your frontline healthcare workers, because while you're saying they are getting all the PPE they need, we've also seen internal memos saying the opposite, Wall Street Journal
Sure.
reporting as well. Can you explain to me the frontline healthcare workers, what specifically are they getting in terms of PPE?
So they are getting everything that the CDC demands that they get. I'm a military person. I came over from the department, which is the coverings, the face shields, the masks, those kinds of things that you see. You've seen some of them in your reporting, sort of look like spacesuits. That's what they get. And they get them according to what the CDC prescribes. So the other thing that I will point out is that VA has not been overrun. I just gave you the statistics. We have 5,000 veterans who have tested positive. We only have 38% of the 14,000 beds in the VA system occupied. And most of those are actually occupied by patients who are being treated for cancer and other maladies. So we have been preparing in the long run for a wave that may come, but that has been part of our ramp up to address this epidemic.
So you don't see this pandemic hitting veterans especially hard?
Well, I just gave you the numbers. Any epidemic, any infection is hard. It is very hard. And we have people in our system who have been in the toughest spots on the planet, certainly my father being one. So I understand the life. Any death is hard. But just to correct the statistics that you had at the beginning of your broadcast, we've had 5,200 test positive. We have 9.5 million patients in our system. So we are prepared for more. And I think we are setting an example for the rest of the country in terms of how we treat not only our veterans, but how we provide support for the rest of the country, as I mentioned, particularly in nursing homes, some nursing homes that are not veterans nursing homes that we are now in taking care of.
I do want to ask you quickly before we go. Washington Post has a new report, a study about the anti-malarial drug hydroxychloroquine. Sure. President Trump has touted this, but it is linked to higher rates of death in the VA, coronavirus related. Can you elaborate what's going on with this drug?
Sure. That's an observational study. It's not a clinical study. It was done on a small number of veterans, sadly, those of whom were in the last stages of life, and the drug was given to them. And I have to also say that we know the drug has been working on middle-aged and younger veterans. And the governor of New York was just in the Oval Office yesterday asking for more of the drug to be delivered to the city of New York. Working in stopping the progression of the disease. So the president's comments have been aspirational. This study that the Washington Post reported on, and one that we put on our website because we're not hiding anything, is just another tool in the toolbox that doctors can use when they talk with patients and families about the best possible approach for care for veterans who have the virus.
Just quickly, I know we're out of time. You're a military man. You are a risk manager. Is
Yes.
it safe for the President
Yes.
of the United States to be speaking aspirationally about a drug? Would you do that?
Oh, I think so. Oh, I think so. I mean, in the military, we have, for every operation, we have contingency plans. We have aspirations built into our operational planning. And that is certainly what the president is doing. And by doing that, he has engaged the best medical minds in the country. I'm part of the National Task Force on Coronavirus. You mentioned I'm a military person. I sit across from Fauci and Birx and Redfield. I listen to the medical experts, and they are the ones who have been informing the president on how to move forward and how to do things in a manner that we've never confronted, or at least have not confronted since 1918.
They've also given very different warnings about that drug. Mr. Secretary, thank you so much for joining me today. I appreciate it. I hope we get to hear from you more in the future.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.